Hey, do you have sciatica or do you think you might have sciatica? Do you have questions about it? We got a question this week from one of our Facebook followers and they were asking, how do I know when I should get professional help for my sciatica problem? My name is Dr. David Midoff. I'm an expert physical therapist and I own El Paso Manual Physical Therapy. I'm going to answer this question and some other follow-up questions that this Facebook person had so that in case you've got a sciatica issue and you're wondering the same things, you can get the best expert advice on how to know when to get help. So how do I know when to get professional help? Well, if your sciatica problem has been there for longer than 2 to 4 weeks, it may have been there for many months or even years, and especially if it's getting progressively worse, it's not getting better, the symptoms aren't going down, they're either staying the same or getting worse, which if they stay the same for long enough, they end up getting worse. Then you need to talk to a professional sooner rather than later, because it's just a matter of time before you run into some serious problems like missing sleep, missing work, not being able to do your daily activities, you take care of your house, take care of your own health. Of course, being able to exercise goes out the window if you've got a major sciatica problem. So don't wait until it gets really bad. It's much easier to treat if you catch it early when it's barely bothering you. A follow-up question that we got on Facebook from this person was, how do I know when I need an X-ray or an MRI? And what we answered, the way that we answered this was, well, for one thing, your doctor will tell you about that. They'll make the recommendation. And I could tell you what usually happens is they'll order an X-ray right away. They just want to make sure nothing's broken, nothing severe is happening beyond your sciatica problem. And they'll delay on getting an MRI. And just in case you don't know the differences, an X-ray shows the bones so they can see any breaks or huge major problems that can show up on an X-ray, and that way they can know to send you to a specialist or the emergency room if you have that kind of a problem. And they'll delay on the MRI, and the reason for that is the MRI shows soft tissues and shows a lot of detail. It shows a lot. But the problem with an MRI is that it typically shows kind of problems. What I mean by that is it shows how we age on the inside, and if you're of any age, you might know that gray hairs start popping up, wrinkles start to happen on our skin, and that's a normal part of aging. Well, we also age on the inside, and MRIs are really good at spotting those aging signs on the inside. So something that doesn't look normal on a disc in the spine, or a bone spur, or arthritis in a joint, that'll begin to show up on an MRI, but it may not be related to your sciatica problem. And so we may not need to know about it right now. Plus it can cause some unnecessary worry in somebody who's getting, a patient who's getting results about their arthritis in their spine that maybe isn't even related to their problem. So doctors will typically hold on getting an MRI. Now, some patients we've had in the clinic here are confused as to why they didn't get the MRI. They didn't have this information, but really it's a good thing if your doctor is waiting on the MRI. Now, there are some cases where they need to get an MRI really fast, and there's reasons for that, but on a typical sciatica case, even severe ones, it's probably a good idea to wait on getting an MRI. The next question we got is, will I need surgery? This is a common concern for everybody dealing with sciatica problems, especially if it's becoming debilitating, where it's not letting you sleep and not letting you take care of your health and your everyday activities. And the answer to this is usually no. Most people can get better, completely better, and stay better for the long term without ever having to get surgery. And the reason for this is the root cause of sciatica is typically found in some joint issue, some muscle issue, and some nerve issue. And if those factors are treated, there's more to it than that. But if those factors are all treated properly, you should be able to escape having a surgery. Only in rare circumstances, and it's typically in the lower back and the spine, when there's a herniated disc that's just sticking out way more than we can safely proceed with, will a surgeon then say, hey, we need to go in there and do something about that. And that can most of the time reduce the sciatica problem. But know that a sciatica problem is very complicated. It's rarely ever just coming from the nerve. There's usually a combination of nerve, joint, discs, bones, other factors to consider. And surgery is really a last resort, but not a complete solution either. So will you need surgery? Likely not, and especially if you catch the problem sooner rather than later. If it hasn't been going on for years and years and years, you should have an excellent shot at recovering for the long term without surgery. And the final question we got from this person on Facebook was, what kind of non-surgical options are out there for me if I've got a sciatica problem? I thought this was a great question because it's not always talked about as far as what things happen. What kind of non-surgical options are out there for me if I've got a sciatica problem? This is a great question. Let me take you through the typical route that a patient will go through if they're talking to their doctor about sciatica. One, they'll get prescribed medications. They'll be given an anti-inflammatory medication or a muscle relaxer. Sometimes they'll be given a specific nerve pain medication. And in more extreme cases, they may be given an injection as well. Now, those medications are usually very effective for sciatica for a short term, for a short period of time, because they're pain medications. They don't solve strength and joint movement and arthritis problems. But in addition to that, you might be referred out to go see a specialist physical therapist like us. Here at El Paso Manual Physical Therapy, we do a thorough evaluation, a thorough assessment of the full picture for an individual of what's causing their sciatica problem, so that we can make sure to address every facet of the issue and solve the problem for the long term. We often get stories from clients about all the things they've tried. Inversion tables are one thing, massage, stretching, exercises that they found on YouTube. And all those things are great to begin to try out and explore, but if they haven't taken away the sciatica problem for the long term, then just consider how likely it is to completely go away if you keep doing those things. If you've tried stretches and it didn't go away, you don't want to keep stretching. If you've done a few exercises and it didn't get better, you want to reconsider those exercises or get some professional help from somebody who knows those exercises, somebody like us here at El Paso Manual Physical Therapy. A word about inversion tables. The theory behind it is if you hang upside down or if you get traction, if you get pulled apart in your spine, then it can create more space between the discs and the bones where the nerves come out of the spine that make up the sciatic nerve. And it's awesome in theory. The problem is you can only tolerate hanging upside down for a short period of time. So what happens the rest of the day? Those questions all have to be addressed in a thorough evaluation and then executed properly in a treatment plan. So just consider all your options when you're looking at non-surgical treatment for a sciatica problem. If you're skeptical, uncertain, or worried that we're just not the right people to help you, or maybe just the medical field at large, you're skeptical about them, then I completely understand and I get it. There's so many people that we've helped that have started like that with us, and we've got something for you. So I've made this free tips guide. It's currently free. It's called the Top 10 Tips to End Annoying Sciatica Pain Using Natural Solutions to Avoid Unnecessary Surgeries, Injections, and Painkillers. This guide we're making available free to you right now. You have two ways to get it. One is find the button nearby and enter in your details and it'll be immediately emailed to you. Check your spam folder if you don't see it right away. And the other option is you can give us a call at 915-503-1314 and we'll mail you a copy of this on us. We just want you to get all the information that you need to make the best decision about how to treat your sciatica problem. This tips guide is all the top 10 tips that we've compiled over the years from all our successful sciatica treatments. We've put it in this guide. This is stuff that works. Some of it is pain relief stuff that helps in the short term. Some of it is a long-term solution. But you've got to play around with it and see what works best for you at home. I hope you have a wonderful day and best of luck to you. Bye-bye.